so much for being with us here today. I want to thank you on behalf of the Network on Education, Biosocial Pathways, and Dementia Across Diverse Populations. This is a network funded by the National Institutes for Health, National Institutes on Aging, and the co-directors. I'm one of 3 co-directors on this project, including Katrina Walsman at the University of Maryland, Sanjay Asana at the University of Wisconsin Madison, and myself, Pam Hurd at Georgetown University. We are really excited today to have Rob Warren with us. One of the major goals of our network is to provide network members and other folks interested in the relationship between education and dementia in late life, opportunities to connect with really amazing sources of data to kind of unpack these relationships. And so on behalf of that broader goal, we asked Rob Warren to join us to talk about his study, EdSHARe. Rob Warren is a professor of sociology and director of the Minnesota Population Center at the University of Minnesota. At MPC, he founded the Population Studies Training Program and was the inaugural co-director of the Population Health Sciences Training Program. Rob has published extensively on issues related to health, mortality, well-being, aging, education, and life course pathways of work and family roles, with related articles appearing in many of the best social science journals out there. He also has a very long and distinguished track record collecting data, the production of those data, the dissemination of these data products for research on health, aging, and education. All of which are funded in part by NIH and NSF, along with other funders. Since 2012, however, he has co-led with Eric Grotsky and Chandra Muller what they now call EdSHARe, which he is here to talk about with us today. So for those of you out there, most of you hopefully on this webinar who are interested in understanding how education shapes later life cognitive functioning, I can just say preemptively that these data offer just a tremendous and unique opportunity to understand these relationships. Before Rob starts, I do just want to encourage folks as we go to put questions in the Q&A. I will monitor that. And if it's helpful to just sort of interrupt Rob, he's being a good sport and will allow us to do that. Or, we may hold some for the end, but please put past questions that you have in that Q&A as we go. So thanks so much, Rob, for being here.
Thank you, Pam. I'm successfully sharing my screen. Excellent. So I do want to acknowledge my co-conspirators, Eric Grotsky and Chandra Muller, but also Jennifer Manley and Adam Brickman at Columbia. If I say anything wise today, it's probably only 1/5 my fault. If I say anything really dumb today, it's probably entirely my fault. So with that in mind, I'll get started. Our collaborative team is often in the world of education research. We do education policy work. We do all sorts of other early life education work. In that world, we are very often using amazing cohort studies that stop about the time things get interesting for aging researchers. As I'll go into some detail in a moment, really good education cohort studies tend to stop when people are in their 20s or maybe early 30s. And thus, you know nothing about what comes after. On the flip side, in a world that you might be more familiar with, aging researchers are very often in the opposite situation. We very often have amazing cohort studies that start somewhere around midlife and follow people forward. And thus, we know relatively little, sometimes nothing, about early life, unless it can be measured quickly and retrospectively. That's frustrating. As both an education scholar and as an aging scholar, for many years, I was frustrated in both directions. At some point, and again, at most 1/5 my responsibility, we had an idea. And the idea was, well, gee, what if we could go back to one of the education cohort studies and follow them forward in time? And that's essentially what we did. And that's essentially what I'm going to talk about today. To get you into the details of what these cohort studies entail and why they might be useful to you, I'm going to start with a little bit of background. And specifically, I'm going to take you back to the mid-1950s, an era in which schools were very recently desegregated, at least legally, an era in which the US was shocked by the Russians' launch of Sputnik in 1957, which resulted in tremendous new research and investment in education, particularly in STEM fields. Back to 1960, a few years after Sputnik, when the US launched a massive cohort study called Project Talent of 440,000 American high school kids. Imagine launching a cohort study today of 440,000 people. Shortly after this was the 1964 Civil Rights Act, the 1965 Elementary and Secondary Schools Act, and then in 1966, the Coleman Report, if you're in any way familiar with education research, was a seminal work on the role of schools and schooling in producing inequality. In all of this context, the U.S. Department of Education and what is now called the Institute of Education Sciences, the National Center for Education Statistics, launched the Secondary Longitudinal Studies program, an effort by the federal government to periodically study the well-being of American secondary school students. The first one, NLS 72, the National Longitudinal Study of the High School Class of 1972, followed a national sample. All of these cohorts are nationally representative probability samples, often with oversamples of really interesting subpopulations. NLS 72 began in 1972 with an interview of 12th graders, and those kids were then followed through 14 years after they should have graduated. And I'll go into some detail about the contents of NLS 72 in a bit. That was followed by a transcript study. So not just interviews, but also collecting secondary and post-secondary transcripts from all of these kids. And then NCES has done this every decade or so. Not always starting with 12th graders, sometimes 10th, sometimes 9th, sometimes 8th. Following them for some number of years, typically until they are in their 20s or 30s. All of these cohort studies are national probability samples. All of them involve extensive survey interviews at multiple points in time about what's going on in these kids' lives, not just in school, but also in their families and their communities and their neighborhoods. But of course, also extensive information about the minutia of their lives in school and around school. There are typically interviews with school administrators and teachers, sometimes parents. All of that repeated every few years. The frequency of surveys has varied across cohort studies. The most recent of these cohort studies, the High School and Beyond 2022 cohort, not to be confused with the High School and Beyond 1980 cohort that I'm going to talk about in a minute. So these are tremendous cohort studies that have powered a great deal of scholarship on education in America. But let me shrink the y-axis here. What we really want is not 14 years after graduation, or when kids should have graduated. We want grade 12 plus many years. And so that's what we're up to. We are today, as we speak, interviewing members of the NLS 72 cohort in a pretest ahead of a 2025 launch of a re-interview of all 15,000 cohort members, at least those that are surviving. And I'm going to go into some detail about that re-interview in a bit. Several years ago, we re-interviewed the High School and Beyond 1980 cohort. These are kids who were either sophomores or seniors in American high schools in 1980. They were, again, followed up repeatedly. We re-interviewed them in 2013 or 2015, sophomores in 2013, seniors in 2015, and then again in 2021. The 2021 data, to give away one of my punchlines, will be available next year. And I'm going to go into some detail about what those data entail. we've repurposed both NLS 72 and high school and beyond to be studies of aging, and particularly of cognitive aging, but also of other sorts of aging-related health, chronic health conditions, and a whole bunch of other stuff that I'll go into in a minute. Will we eventually follow up the NELS cohort? Probably, but it's going to be a while until they're old enough to have chronic conditions like cardiovascular disease or cognitive impairment to be of sufficient interest to funders, I think. So it may be a few years before we go back to NELS 88, but who knows? Oh, sorry. So we have followed these education cohorts forward to repurpose them as aging cohorts. So EdSHARE, an acronym that stands for Education Studies for Healthy Aging Research. Right now, EdSHARE consists of 2 cohort studies: the National Longitudinal Study of the high school class of 1972, NLS 72, and the high school and beyond, the original high school and beyond cohort. These are people who were kids who were sophomores or seniors in 1980, so they would have been in the class of 80 or 82. So the 2 things I'm going to talk about in some detail today are the design and contents of the 2021 follow-up of high school and beyond. And again, those data will be released next year. And then a preview of what we're doing in 2025 with NLS 72. So let me jump in. High school and beyond. As I said, high school and beyond started in 1980. Kids would have been about 16 or 18 in that year. In the base year, there were about 60,000 kids. All of these NCES studies are 2-stage probability samples. So they randomly select schools, public, private, Catholic, and then they randomly select kids from within them. In high school and beyond, there were about 1,000 schools selected at random from across the country, and then about 60 children selected from within them, which is really nice because it allows you to aggregate student level data to the school level, in addition to school administrator reports of various things. The high school and beyond sample was not all followed up. Only about 26,000 kids were selected at random, again, to be followed up through a series of follow-ups. The sample that was selected for the panel was still a random probability sample, but with overrepresentation of particularly interesting population subgroups. For example, high-achieving African-American students are oversampled. For example, it was 1980, Cuban students are oversampled. But so about 26,000 kids in the high school and beyond panel, the cohort portion. These data, and I risk hyperbole here, contain extraordinarily detailed information about these people's high school and college experiences, if they went to college. Not just how far they went in school, but what kind of grades they got, whether they took trigonometry, the characteristics of all the people they went to school with, the characteristics of their teachers and their schools, aspirations, almost anything you can imagine wanting to know about school and the process of schooling and the contexts of schooling, we have measures of, both from student surveys, but also from school administrator surveys, and from transcripts, as I mentioned, from high school and college transcripts. Oh, I made a list. Here are the kinds of things we know about from students, and this is just a sampling of maybe the most commonly used kinds of things. I should say that all of these cohort studies, these NCES cohort studies, did multiple achievement tests, typically in math, reading, vocabulary, science. And those tests are designed to be comparable within cohorts, so you can study change within high school, but they're also designed to be comparable across cohorts, so you can study differences between the high school and beyond cohort and the NLS 72 cohort. From the high school principals and teachers, we know all sorts of things about the environment of schools that you wouldn't want to ask kids to report. Things about policies and procedures and the qualifications of teachers and the like. We also have precise geolocations of all of the schools. which will in time allow us to look at the influence of any kind of contextual exposure that is spatially defined, whether that's public policies, environmental exposures, exposures to things like traumatic events, or anything that you can define spatially, we can link to the high schools. In the post-secondary years, for those who went to college, we again have extraordinary detail about both the students' experiences within college, what they accomplished, but also what they did, and then information about the institutions they attended, and again, precise spatial locations. The sophomores were followed up in 1992. I should say that these cohort studies have remarkably, even for their time, high response rates, north of 90% in the initial years, only 85% in 1992. High school and beyond is the basis of almost, was the incubator of almost all research initially on issues like the racial achievement gap, gender and STEM, what is social capital and does it matter? How can we say whether private schools are more effective than public schools? Curriculum tracking. High school and beyond was the basis of all of this research. But that's not why we're here. My colleagues and I followed up high school and beyond in 2014 or 2015, depending on whether it was sophomores or seniors. In part, the idea was, can we even find these people? And will they even participate after all these years? And the answer is yes, we can find them. And we were able to complete surveys with almost 60, a little over 60% of them, and also to link to a variety of administrative records that I can go into some detail about at the end. Knowing that we could do that, we then received support from NIA to do a more extensive interview or contact in 2021 when people are approaching age 60. This time we combined surveys with health visits. Either telephone or internet surveys were completed, and then anybody completing a survey was invited to do a home health visit where a phlebotomist came to your house and extracted blood and collected saliva. And this was done in the middle of COVID, which we can talk about. We again linked to all sorts of administrative records, ranging from death records to voting records to consumer credit records to pharmacy and state tumor registry records. So why might you be interested in using the collected 80 through 2021 high school and beyond data? I would characterize most research in the ADRD world that looks at either racial or educational disparities in ADRD in the following way. They certainly recognize those disparities, but they think very much in terms of intervening in late life. And that almost always means drugs. How are we going to fix those who are affected in order to lower rates of dementia, but also reduce educational and or racial disparities? That's sort of a biomedical approach. We take a sort of a different approach in the design and conceptualization and execution of high school and beyond. First of all, we don't think in terms of race as being the independent variable or the exposure. We think in terms of racism and opportunity structures and inequality and public policy and childhood conditions and all sorts of other early life factors. We also don't think in terms of just educational attainment. Most research on educational disparities, and I think you all know this, focuses exclusively on the highest degree that people attain or the years of school they complete. We know that's important and we consider that as well. But we also consider the content and contexts of schools to be really important drivers as well. And so that we conceptualize a bit different. All of this points to early life as being a place to potentially intervene on opportunity structures, on the operation, the practice of schooling, policy related to education, which we intervene on all the time as a society for a variety of different reasons. It's a reconceptualization of how we might think about alleviating racial, but also educational disparities in cognition. That doesn't get us out of, as a more social science perspective, doesn't get us out of the business of thinking about the biology of all of these processes, how genetics might matter, and then the biological pathways through which education and early life conditions might shape cognition. Fundamentally, this is what EdSHARe is about. How do education and racism and childhood circumstances influence the biological and social processes that shape cognition in mid or late adulthood? Our focus is cognition. I'm going to talk about cognition today, but as an aside, we could ask the same basic question with respect to physical health, mental health, mortality, well-being, happiness, etc. The same basic framework would apply, and these data, I think, would be useful in any of those respects. A corollary of that initial question, can we modify early life, especially educational experiences, policies, contexts, to reduce the incidence of dementia and inequities in dementia? So how did we measure all this stuff in 2021 in high school and beyond? As I said, it was a mixed mode fieldwork operation, either telephone or internet. The telephone survey consisted of cognitive batteries and a whole bunch of other stuff. The other stuff is briefly listed here. Updates on their educational histories, stuff about their families and households, a whole lot of things, self-reported things about health. This was the middle of the COVID pandemic, so it's not surprising we asked about that. Experiences with alcohol, opioids, loneliness, psychosocial functioning, money, work, financial insecurity, science knowledge for reasons that we can talk about later if you like. The folks who completed the phone survey were then asked to complete a home visit where a phlebotomy company called Exam One, which also works with AdHealth and HRS, would come to their home and draw blood, do a bunch of other physical assessments, collect some saliva, and get consent, written consent for linking to pharmacy records. However, in 2021, we all know that phone survey response rates are low. And so it was important to us to allow people to respond by internet, whether it's their phone or their computer or their tablet. You can't do the same cognitive batteries that you can do on the telephone that you can do on the web. And that's been a key methodological challenge for us. Instead, on the web, we did a screener for mild cognitive impairment and collected all the same other content as we did on the telephone. People who responded by web but did poorly on the web screener were incentivized and asked to go do the phone survey anyway. So thank you for doing that web survey, but we'd really like to follow up with a phone survey and we'll give you an extra X dollars for doing so. We didn't ask them the other content twice, but that allowed us to get a better assessment of cognitive functioning among people who did poorly on the screener. If you did well on the screener, we asked you to do a home visit and you're done. For methodological reasons, to validate the screener, a percentage of people, about 25%, who did well on the web screener were still sent to the phone survey anyway, which allows us to develop psychometrically valid measures across modes of cognitive functioning. Otherwise, you could only do analyses of modes separately. And then everybody was linked to a variety of administrative records. That's the basic design. We also threw in an emergency paper survey for last responders and a proxy survey for those who were unable to complete the survey on their own for some health or cognitive reason. So here's the basic design, or the basic conceptual model of what we're trying to think about. How did we measure this stuff? So everything in red now, education for sure, but everything on the top left there comes from the 1980 through 1992 surveys with students, administrators, parents, and also transcripts. So that I won't go into too much detail about. Genetic risk, as I said, we collected blood and saliva, and we are in the midst of doing things like assaying for ApoE4, but also more extensive sequencing. In those years, we collected about 47 gallons of blood, which is about an average bathtub, and about 3 gallons of saliva. Biology. So I said it's important for us to conceptualize and measure biological factors that intervene between early life and late life cognition. And here I'm really talking about 4 things. One, and perhaps most prominently, are biological markers of dementia risk, but also biological aging, the microbiome, and COVID-19, given the context that we collected these data in. So let me talk quickly about each of those. Biological markers of dementia risk. Here we focus on 4 pathways: ADRD, so neuropathology, vascular pathways, inflammatory pathways, and immunological pathways. Again, we collected blood. We collected a lot of blood. Those of you who don't do these kinds of fieldwork studies, this number might not mean anything to you, but we collected about 62 milliliters of blood for everyone, which is a lot of blood for this kind of study. And that allowed us to collect a lot of blood in a variety of different tubes. Different tubes are assayed for different kinds of things. If you care, here's a map of the tubes. The neuropathology markers that we assayed for are listed here. This is an ever-moving target, but this is what we have done to date. And these are the vascular, inflammatory, and immunological markers that we've assayed for so far. But remember, we have a lot of blood in freezers at minus 80 degrees Celsius. So we're in a position to be able to add assays or to take applications from outside researchers to do additional assays that might be invented in the years ahead, or that we just didn't do for whatever reason. In addition to blood-based markers, we also got anthropomorphic measures of things like height and weight, and hip and waist circumference, blood pressure, and the like, which are useful in thinking about things like inflammatory processes and cardiovascular health in general. So those are that's where we are in biological markers of dementia risk. Biological aging, we are doing the work to construct a variety of clocks, markers of systemic aging that may or may not be happening at the same pace as chronological aging. And those markers are listed, the clocks are listed there. We could talk about that more if you like. Part of the goal here is to understand whether cognitive aging is a byproduct of broader systemic biological aging, or whether the two just kind of co-occur on generally parallel, but not always parallel tracks. And we hope, particularly with another follow-up of high school and beyond, to be able to unpack that. Besides markers of dementia risk and biological aging, we have interest in particularly the oral microbiome. The oral and gut microbiomes are very closely linked. It's much easier to get people to provide saliva than to provide fecal samples. And so we've collected oral microbiome samples from thousands of participants. The oral microbiome, as you may know, is the collection of, to use a technical term, creepy crawlies that live in your mouth. The composition and diversity of those everybody has them, but the composition and diversity of the kinds of creepy crawlies in your mouth shape your risk of all kinds of chronic conditions, including Alzheimer's disease. And so that's the main reason we propose doing that, but down the road, it can be used to study all kinds of other outcomes. We collected saliva, as I mentioned, through an Omnigene kit where we've collected and stored it. We are doing 16S sequencing right now. Provided that goes well, we'll do broader metagenomic sequencing down the road. So we conceive of the oral microbiome, much like some of the other biological markers, as a pathway through which early life can shape cognition. And finally, COVID. there are all kinds of hypotheses about how COVID might shape biological, but also social conditions and factors that in turn are believed to shape cognition, ranging from risk of stroke and brain inflammation to stress and loneliness. We have measures of most of these things, but it was important to get information about people's experience with COVID. I'm reminded of a Scientific American article that came out in 2021 or late 20, arguing that there may be they call it a tsunami of dementia on the way as a result of the COVID pandemic. So survey questions about whether people have had COVID, which was relevant at the time, it's almost universal now, whether they've been tested, whether they've been vaccinated, details of their vaccine, questions about the economic impacts of reduced work due to COVID shutdowns. We added a series of items about loneliness for this purpose, and also a series of items about science knowledge, borrowing the NSF science knowledge battery that also appears on the General Social Survey, to understand whether people's decisions about getting vaccinated were related to broader knowledge about science as adults. And of course, we know a ton about their early life science knowledge and science course taking and science-related college majors and careers and the like. So this is ongoing work. We, of course, also had blood, so we were able to see whether people had antibodies and had been vaccinated. Okay, so that's the biology. With respect to cognition, what did we measure? As I mentioned, it was a dual mode administration. Back to this basic design, people either completed by web or phone. Those two modes differ with respect to our measures of cognition. On the telephone, we did a fairly standard set of measures, ranging from immediate recall, the SIRAD word list, letter and category fluency, so also called phonemic and semantic fluency, forward and backward digit span tasks, a delayed recall task of the word list, and then a series of questions about memory complaints, whether they've experienced changes in their memory and how much that troubles them. On the web, it was more of a challenge. We had to develop, we had to use cognitive batteries that were validated as screeners for MCI. And the idea wasn't to say, okay, this person is cognitively impaired, this person's not. The idea was to say, this person is absolutely cognitively normal. If not, then let's get them on the phone to get a more complete set of cognitive batteries. So we essentially sent the bottom 25% of the distribution of people on the web to the phone. But the web is not the same thing for everybody. We had to have tasks that worked on computers, tablets, phones, Apple and Android, slow connection speed, fast connection speed, good internet, bad internet. And so after some exploration, we decided on a verbal paired associates task. That task basically presents the respondent with a pair of words, and then after about 25 of those pairs of words, asks them, okay, which word went with officer in this case? A fairly simple association task, and it was kettle, by the way. We then did a visual version of this, a visual paired associates task. Here's two pictures. And then later on, after seeing a whole bunch of pairs of pictures, which picture went with the in this case, barn that's highlighted at the top left. And it was that one. Those tasks, and then the same self-reported memory complaints. The verbal and visual paired associates tasks are pretty well validated as screeners. But again, the purpose wasn't to diagnose anybody. It was to screen out people who are not obviously cognitively normal, and then send them to the telephone. So that's how we measure cognition in 2021. As I've said before, this is also a study that is extremely useful for studying mortality. We have links to NDI including secondary causes of death or contributing causes of death. It's an interesting cancer cohort. We have self-reported cancer histories. Hundreds of sample members have died from various forms of cancer, but we are also about halfway through linkages to state tumor registries. So this will ultimately become, I think, a really important cancer cohort. It's a CVD cohort, given the kinds of measures that we've collected. It's a reasonably good mental health cohort and other things. And as I said, these data will be available to the research community in 2025 through restricted data protocols, and we are furiously gearing up for that dissemination. That's high school and beyond. NLS 72, sister cohort, 8 years older, very similar design back in the day. Started in 1972. They did more frequent follow-ups for some reason early on through 1986. These are all high school seniors, so they had to have gotten to their senior year. And they were followed through when they would have been about 32. About 15,000 people in the cohort. Again, very high response rates back in the day. Again, interviews with administrators, parents, teachers, etc., and transcripts. Our planned, it says 2024, it's really 2025. The 2024 is the pretest that's going on right now. A set of surveys, cognitive assessments. This is an in-person visit as opposed to the web and phone activities for high school and beyond. We're going in person to NLS 72. So the surveys can be more extensive. The cognitive assessments can be more extensive. The anthropomorphic measures can be more extensive. The surveys cover all the same topics as high school and beyond, and then some, including adding more items on things like ACEs and childhood conditions, racial identity, skin tone, more information about health conditions, particularly those related to cognitive outcomes, and criminal justice, and so forth. A much more extensive set of survey items. The cognitive assessments also are much more extensive. Most of the same high school and beyond tasks have been replicated, but adding a variety of other tasks listed here. If anybody ever wants to come back to this to talk about these, I'm happy to. The physical assessments are a little more extensive as well, getting things like grip strength, vision, arm span that were not gathered in high school and beyond. We are again gathering blood and saliva from everyone. And then for 500 randomly selected participants who live near one of 4 MRI sites in New York, Baton Rouge, San Diego, and, oh boy, Chicago, we will bring folks subsequently into MRI centers to do harmonized scans. And that is also being piloted right now. So that'll give us really important information. It's as much to prove that we can do it. And part of the key here, building on efforts that haven't gone so well in other population-based samples, is thinking carefully about how to bring a diverse population representative group of people into MRI centers. How do you get people to feel comfortable doing that? How do you incentivize them to do that? And so we're working with MRI centers that have a track record of doing just that, of bringing in a representative group of community members, not just the typical person who volunteers for research studies, which tends to be more middle class, typically white, most often particular gender. We are gathering all the same extensive administrative records as in high school and beyond. Most recently, we added consumer credit records, which are extraordinary. They go back to about 2002 with amazing detail about people's financial and economic conditions. Same basic underlying question for the NLS 72 cohort. How do education, racism, and childhood circumstances influence the biological and social processes that shape cognition later on? NLS 72 folks are at about age 70, high school and beyond about age 60 when they were interviewed before. Why 2 cohorts? Well, first of all, they are by design comparable in their sampling frames, in their early life achievement tests, and their early life survey content. They are designed to be analyzed together. They are also at strategic ages. Very few people at age 60, when we saw high school and beyond folks most recently, very few of them have full-blown dementia, but there's a great deal of heterogeneity in their cognitive functioning, and there are clearly signs of early signs of cognitive impairment in some population groups. The NLS-72 cohort is age 70, which is the age at which you will begin to see more serious forms of cognitive impairment. Eventually, we will go back to high school and beyond when they were 70 to allow a same age cross cohort comparison. These are also two cohorts that grew up in distinct historical eras. High school and beyond kids went to school from kindergarten on in an era in which schools were at least supposed to be desegregated, and in which women were, it was normative. Of course, you'll go into the labor force. And there's a variety of other, high school and beyond was not a wartime cohort, whereas NLS-72 folks were thinking about the Vietnam draft. EdSHARe, two cohorts, education studies for healthy aging research, high school and beyond, and NLS-72. You can learn a ton more about the cohort study at edshareproject.org. I'm going to put up a QR code. It's been in the bottom left the whole time, but I'll put it back up in a second. You can get copies of survey instruments, information about how to access the data, sign up for our newsletter, get information about presentations that we're doing, and the like. For example, if you go there today, you will see information about a pre-PAA conference workshop that we're doing on Wednesday of PAA in Columbus in April. To learn all about particularly high school and beyond data, since we have those. And I will advertise for early career folks, there are still a few scholarships available to attend that for free. For some reason, PAA charges $300 to attend pre-conference workshops, but we can offset that cost for a few more people. Thank you to NIA and to the Alzheimer's Association for their funding. And here are QR codes, one to the project website and one to the High School and Beyond 2021 cohort profile in the International Journal of Epidemiology. That is a nice place to read about high school and beyond in particular, and we're on the way to having a parallel version for NLS-72. All right, I'm going to stop. I'm really eager to hear what questions you have about all of this. I don't know how we're going to do that. I think Pam is going to moderate.
Yeah, thank you so much, Rob. That was fantastic. I'm going to just, again, really encourage folks to put questions in the Q&A, and I can ask those for you. I guess in the meantime, one thing I would ask you, Rob, is just generically how you all share your data. We may have some folks on here who are used to data sets that aren't typically publicly available. So I wonder if you want to take a minute and talk about that.
Sure. So the samples are owned, not necessarily the data, but the samples are owned by the National Center for Education Statistics, which is a weird sort of a thing for what many people will consider an aging and dementia cohort. But that's the reality. So survey data are disseminated by the National Center for Education Statistics, including our survey data from 2021. That requires applying for a restricted use data license. So you would fill out some paperwork, promise to use the data in a secure fashion, sign an affidavit, and then set up a non-networked computer at your workplace that would be where you would analyze the data. The Department of Education is not so interested in releasing things like pharmacy records and blood assays. And so those will be distributed through the Global Alzheimer's Association. I can't remember what GAIN stands for, but it's all on the website, through other vendors that are actually not so hard to get data from, but linking the data, the survey data, to the biological markers will have to happen with permission from NCES. And we can walk you through that. We are happy to work with people to get them started on those applications. It's not as easy as just downloading free data, which is the model I grew up with, but it's also not as hard, for example, as working in a federal statistical research data center. It's somewhere in between.
That's super useful. And so folks can contact the studies. It sounds like folks.
Absolutely.
Great. Okay, so I have a bunch of questions here. Do you have siblings linked in the data in the 1980 and 1982 grads in high school and beyond?
There are some, they're in the dozens, however, because you would have had to either have a twin who, well, in the sampling, if you had a twin, they were sampled. If you had a sibling, if you were in 10th grade and your sibling was in 12th grade, they weren't oversampled. So there are some dozens, maybe 50 pairs of siblings in the base year. Were all of them participants in 2021? Maybe, maybe not. So we're underpowered to do sibling analyses and to do twin analyses.
Okay, great. Thank you. Another question here. I heard a lot about health problems, loneliness, and so forth, but do you have good measures on contentedness, life satisfaction, especially healthy people?
No. This is, and I say no with sadness. For high school and beyond, you can't keep people on the phone forever. And you can't get them to stick through an internet survey forever. And so really, really hard choices have to be made. And that's something that's a weakness. Another thing that's a weakness, this is not a good family cohort. And nobody's gonna use these data to do family research. We know if people are married. We don't even know in late life how many kids they have. We do from the 80s, which probably covers most people's childbearing, but there are content area weaknesses, and I would say more life outcomes. Any life outcome that I didn't list, we probably don't have great measures.
Why was there a gap 20 to 30 years between the most recent follow-up in the 90s and the 2000s?
Yeah, as I said, the National Center for Education Statistics, as you saw in that graphic, pretty much quits following people when they're in their late 20s. So they had no interest in, I mean, under their mandate as a federal agency, they're about education. And so if you assume, it turns out it's not true. One thing we learned in high school and beyond, it's not true that most people quit their schooling after about their late 20s. Some huge percentage of people get additional degrees or go back to school after that. But anyway, that's the logic from their point of view. From our point of view, we just didn't think of it. When we went back to these cohorts, time had passed. We could go back to the next cohort in the sequence, the National Education Longitudinal Study of 1988. Those people were all 8th graders in 1988, which means they were born in the mid-70s, which puts them at about age 50 now. So they're a little young, but it's conceivable, right? But then it's only been 20 years since they were recontacted.
I like hearing a 50-year-old described as young. Thanks, Rob. Okay, so this is wonderful. Thank you, Rob. Maybe I missed it, but in terms of food systems and dietary data, are there data about location of grocery stores, store types, dietary patterns?
There is none, but we have GIS coordinates of where they lived in high school. For high school and beyond, it's a little different across the cohorts. For high school and beyond, we know within a few feet of where their school was, and we know where they lived in 1986, 2013 or 15, and 2021. And that means you can map, if you have data on where grocery stores were located in 1986, I can tell you how many feet it was from their house to the nearest grocery store.
Can I follow up to that, Rob, and ask if folks would be able to contact you to figure out, for example, if they were interested in generating funding to help you guys do that?
Yes.
Would you be interested in those kinds of
Yes,
collaborations?
yes. I was actually going to interrupt and say yes after you said, can people contact you? Yeah, absolutely. These are data for people to use. We are those who are producing the data, but we very much want these to be data for people to use. So if someone is interested in developing a funding proposal to use the data to do something cool like that, we are all for it. The situation in NLS 72 is a little better. And for bureaucratic legal reasons that I don't have time to go into, we're going to have much more extensive information about where they lived over many years. We also get zip codes from consumer credit records. So every zip code that they ever lived in.
Wonderful. Well, thank you oh, nope, I've got it. Yay. I've got another question. Such a cool study. Do you have measures of other neurodegenerative diseases like Parkinson's, for example?
We don't have, Pam introduced me correctly as a sociologist. I don't know how one determines who has Parkinson's. Is it like do you go into a clinic and you can do some tests, or is it, or would you rely on biomarkers? And because, yeah.
I mean, I think that would be something you'd have in terms of either self-reports, or if do you not, you have linkages to medical records, right? Did I hear that, or am I misstating that?
Not yet.
Not yet. Okay, but you will eventually.
Oh, certainly prescription drug records.
Yeah, I think
That we
there's
have.
two ways. Yeah.
Yeah.
This would be the kind of thing, if I could, sorry, Rob, and you can just tell me, Pam, you've gone too far. But I think this is the kind of thing that would be good to probably follow up with Rob directly, because these are the kinds of things where there may be data linkage opportunities, or the use of administrative data to generate those kinds of data for folks.
That's right. Let me say a word about prescription drug records. The phlebotomy company that we use to go collect blood from folks, Exam One, and which also does this for the Health and Retirement Survey and at Health, their main line of business is life insurance. So they have phlebotomists all over the country because they send them to people who are applying for life insurance, and we use them for research. But along the way, they do all kinds of other things to collect information about people to tell the life insurance companies. So in a operational meeting one day before we got started, one of their bosses said, "Hey, would you guys ever be interested in prescription drug records or pharmacy records?" And we said, "Why, maybe." And it turns out you have to get written consent. But for everyone who gave consent, we will have up to 7 years of extraordinarily detailed prescription records for about 80% of the cohort, down to the level of what branch of the drugstore did you get the drug from, what time of day, what was the frequency with which you actually filled it, what the dosage was, and then some, I presume, AI generated information about the most likely condition for which this drug or combination of drugs would be prescribed. Interesting. They also can provide similar information about laboratory testing, which we didn't pursue for high school and beyond, but are for NLS 72. Yes. So we may have repeated cholesterol tests or the like.
So long-term potential here is really great. And again, I think for folks who are really interested in this, I can certainly speak for myself as the director of a study. It's great when you have people who are interested in kind of helping build these kinds of data for you. Some collaboration basically can be really.
Don't get me wrong. We have a series of papers that we're working on that we're very excited about. But in 10 years, when all 5 of us really hope that 99% of the research going on with these data are not by us.
It's a great way to talk about it. Okay, one more question here. Is there data on sensory function, hearing and vision? Also, is there data about caregiving?
No data about caregiving. that's a weakness. It's in the plans for the very sketchy outline of the hopefully to be funded 2028 or so new follow-up of high school and beyond. But we're weak on caregiving. In high school and beyond, given that we were doing web or phone surveys, we couldn't, I don't think, very well do sensory testing. But for NLS 72, which is in person, we are. We have gone back and forth about which suite of hearing and vision tests we're doing. We've, NIH toolbox, but then there's alternatives, and we've experimented with a variety of different alternatives. I can't even honestly remember which one we're pre-testing right now, but we'll reevaluate after the pre-test. So we will have good measures of hearing and vision, not of smell, which we thought about, but decided not to pilot.
Okay, fantastic. And so for folks on here, if you want to look, Jennifer has been very diligently here actually typing up responses to Rob's questions. So if I'm going to, before I log us off, I'm going to give folks a chance to look at that and copy it if they want. If there's any answers that they want to copy. But I really want to thank Rob for taking the time to do this, for Jennifer to setting it up for us in such an organized way. And Rob is also, although I don't think everyone can see this in the chat.
Oh, sorry.
Yeah. So it's actually easy though, if you want to look at those data online, if you didn't grab the QR code, it is EdSHARE, EdSHARE project.org. And if you just Google EdSHARE, it'll pop up too, I think. But again, thanks so much again, Rob, for doing this. This webinar will also be posted on our website, and I believe Rob is going to post it on his website as well. So if there's something that you want to go back and look at, you can do that as well.
Thank you for inviting me. This is really fun.
Okay, well, thank you. Okay, take care, everyone. Have a good afternoon.
Bye.
Bye-bye.